Of course, joining us, I believe, in Nairobi. Good morning, Governor. How are you doing?
I'm very good, Sam. Thank you for having us this morning.
Right. So let's get into the conversation. And of course, you're talking about the COVID-19 pandemic in the country. Yesterday, we saw the meeting of the summit between the governors and the president, and we had some of the measures. There are several Kenyans who are expecting that maybe the measures would be more stringent, including returning to a lockdown. What would you say was the highlight of the meeting in as far as the battle so far against the pandemic?
Well, I must say it was a very productive meeting because, as you can imagine, the battle is actually being fought at the county levels, noting that health is devolved, and therefore involving all governors and all counties was very commendable. But I think the big question before all of us as a nation, and that was the message yesterday, is that we have to find a balance between lives and livelihoods. That arising from lockdown, sometimes there are other secondary consequences that may not be desirous, both to the economy and also to the individuals that have also had very negative impacts. But it must also be said that if people were to follow the government restrictions and if they were to follow the protocols given by the government, we are confident that we will be able to work together and combat the COVID-19. I must also say that we have seen a lot of what you may call non-essential travel. And I think for now, we want to believe that Kenyans, for those who didn't believe that there was this pandemic, now we are getting into a situation whereby you have a friend, a relative, a colleague, or somebody known to you who has suffered, which was not the case before. So I think the issue of self-discipline and people getting to appreciate the seriousness of the work has gotten serious.
I'll shortly get into the specific measures that have to be taken by the counties. But first of all, the president announced that there will be no sale of alcohol at eateries and restaurants. And people are wondering, is there real evidence to show that, excuse me, there are several people that have contracted the virus because of partaking at such areas, and that eateries are pushing the numbers up?
There is compelling evidence. I think what's happening first, we must agree that our children are home, meaning they're no longer going to school. And it would be most unfortunate if the parents of these children go to the bars, contract, and bring it to these innocent children. But I think beyond that, we have seen bars working beyond scheduled times. We have seen bars and eateries working against the 1-2 meter social distancing rules. And I think all those things, including after the normal 9 o'clock, people locking themselves and closing the curtains, and the normal consumption goes on. And the idea behind social distancing and restricting social contact was that people don't have a place to meet. Therefore, even if you are sick, the places where you can take your virus is a bit limited. But if I can go to one pub today, tomorrow another pub, the other day another pub, then the points of contact become more. And the guy who came to that pub where I was yesterday will go to another one. So the possibility of infection across a whole town or even across a whole city goes high. But when you deny people social meeting places, even churches for that matter, they reduce the infection rate. So I think at least for pubs, people can drink every day. Churches, at least you go once a week. So I think there's a compelling case, and also having seen how Kenyans have responded to some of the responsibilities given to them, we think that denying that right to alcohol sales was done in good faith and in the best interest of the country.
And Governor, what are the biggest challenges or concerns that the governors have as the next phase of fighting the pandemic begins?
I think first it's important to note that from 6th, when we eased restrictions on movement, there has been a near double increase in terms of the number of people who are affected. And that simply means that maybe 1 month from now, if again we are to extrapolate, and let me just use the Nakuru example, we were at about 70 on 6th. Today, we are at 277, which means maybe in another 1 month from now, we may well be around 700 plus. So look at that rise, that curve, it has suddenly changed from 6th. So I think the point to note is that we are headed to very challenging times. And maybe the only comfort is that the number of deaths remain very low and compared to other regions. Like for Nakuru, we have 7 out of 277 cases. We are also anticipating that in the coming days, we want to train more and more of our healthcare workers, especially the community-based ones. These are the people who are based at the lowest level in the society, in the village. on the idea of home-based care. And what we'll be saying is that home-based care, you don't learn it when you have turned positive. These are skills you need to have way before you become positive, so that in the event you are confirmed positive or any of your loved ones, then you'll just be applying those skills. So for us, for example, here in Nakuru, we are trying to come up with short videos and all those other explanatory sort of literature that would help an ordinary person back there in the village who finds himself in this situation to have the skills necessary to deal with this disease. And maybe lastly also is to note that a lot of our patients are also asymptomatic. So again, the problem is that we have had a major challenge, a backlog in terms of screening. And therefore, to the extent that a person is not aware that they have this COVID, then they will continue spreading. And that is why we are saying for any person you deal with, for any person you come into contact with, I think the most important thing is to treat them as suspects. Everybody you meet is a suspect, so that later when they become confirmed, you're not left in a shock and wondering why you did not take certain precautions that you would have taken. But I think moving forward, as counties, we want to move to the issue of home-based care, to train our people, and I think also more importantly, to work towards the enhancement of more skills at the grassroots level. Because even if you do the 300 beds, Nakuru, we are currently at 458 beds. But you're very conscious that still remains a drop in the ocean for a population of 2.2 million people. So I think the bigger conversation now is how can we enhance community knowledge, community skills, because I think also the other thing we need to agree, when somebody has been confirmed and they're in their own house, they cannot go out there to buy food, to buy some medication and do all those things. So we'll also need other people within the entire value chain who can say, well, I may not be a doctor, but I can carry medicine, I can take this kind of thing to somebody who is suffering. So again, we will be getting people, and I think this is where the president was saying, that we also need volunteers and people who have retired before who may be willing to work with us. And organizations like Red Cross and other youth groups will be particularly critical in this stage.
All right, and Governor, I'll take you back to that conversation shortly. But first, let's take a look at the numbers that we have, because we know that in Nakuru County, our figures are a little different from what you just said. If you can put that online, on air. So we know that the total infections in Nakuru as of, that is the total new infections in Nakuru as of the 26th of this month, that is on Sunday, were 202, coming from 80 at the time that the lockdown was being lifted. So currently, we know that Nakuru has a total of 282 infections. There you have it, Nakuru at 282, and it's nationally it's number 1, 2, 3, 4, 5, 6, 7. It's number 7 in terms of yes, the total case load. So getting back to you, Governor, so when you look at that number, you said that yours is 277, you have a difference of 282, but all the same. So when it comes to testing, like you say, most counties do not have that capacity. As Nakuru, how are you dealing with this to ensure that you're able to detect and isolate as many as you can before they can continue to spread the virus?
Currently, we take all our samples to Nairobi, which I must say ends up taking a lot of our time, which is not good, because if it takes about 3 to 4 days before you give a suspect their results, then it means that during the intervening period, there is a possibility of risk and also the psychological trauma of waiting for too long, waiting for the results. But I think the bigger question that we need to be dealing with is how we can have the testing here in Nakuru. And I think this is a conversation we've had with the national government severally. And the last time the Minister for Health visited Nakuru, we made it very clear that given the population here and the disease burden and risk exposure, we needed one. So I think in the coming days, this is an area we are working together to ensure that we have a testing center. The other thing to note is that we have the inland container terminal. And this is where all the trucks going to Kampala and all those other places come to lift their cargo that has come through the port of Mombasa. And this has actually turned to be one of our biggest challenge. As it is right now, a majority of these 282 confirmed are actually truck drivers. So in terms of local infections, it will remain low, but nevertheless, when it comes to medicine, we cannot say that it's this category or the other. So that is really the area where you have a challenge, and most of them actually happen to be from other places. As you can imagine, some are foreign, others come from all over the country, but that's really the big challenge that we need to deal with.
Right, and Governor, yes, you say that your capacity in terms of isolation beds is at 488, and yesterday the President said that the Minister of Health will come up with protocols on how to recall or retain retired officers, medical officers, especially those in critical care. I'm just wondering, how is your human resource, especially if you have to have a surge in the COVID-19 cases, and especially to do with those that are critical and need critical care?
I think the first thing we need to note is that the number of beds you're talking about are additional beds. These are not your normal beds, which means that you're carrying out your normal health functions. And besides that, you add another 300 beds. And for the case of Nakuru, 458 other beds. And this would mean new workload. So actually, we're in the process of recruiting. But I must say that given where we are going, there may be need for short-term sort of employment, because we anticipate that in the coming days we will have a high demand for health workers, both at the community level, at the hospital level, and moving all the way up to the top. And also for the retired personnel that the President talked about, it's good to clarify that most of them with very high skills would be important in actually training those who now go to do the job. Because some of these people may be probably in their 60s or maybe even thereafter, and therefore maybe putting them frontline given their age might be a bit of a challenge. But I think on a need basis, I think some of these things can be evaluated. But the idea would be to help us. Some of them are in public health, some of them are in emergency care, and it's good to note that a lot of our counties previously did not have what you call like the ICU facilities, which I think is something that we all need to appreciate. That this pandemic has also made us look at areas that have previously been largely ignored, like health. And now by the end of this pandemic, I think almost every county in Kenya, even small hospitals, will have upgraded their health facility to a level that now can take us to the next. Yes.
Right, and Governor, yesterday I think we had a story about the procurement department in your county, the staff being asked to work from home, and also we have seen in the national government, especially at the National Treasury and the Teleposta Towers where the ICT Ministry is headquartered, several actions being taken, having staff working from home. How much of an impact has this pandemic been on, especially to do with the service delivery and how your staff are affected?
I think the pandemic has affected us at various levels, but I think the first one is at the budgetary level, where we now have to get our resources from agriculture, from roads, and all these other areas to come and take it to health. So that's the first level. The second level is that from last week, we decided to do mandatory testing to some of our staff, noting that exposure remains high to all of us, including my office. And as a result of that, we saw that within the procurement department, we had a few of our staff who turned positive, and since then we are doing what is necessary to ensure that their health is restored, giving them the necessary care. And we'll continue with this mandatory testing.
Right, of course, you will be following up and see how that is going in Nakuru. Let's switch gears and focus on the standoff currently at the Senate, because you understand that this afternoon the senators will be back at it to try and resolve an impasse that has been there to do with the revenue sharing formula. Nakuru County is one of those counties that stands to benefit in terms of additional resources. I don't know where your voice is. I've seen your senator very vocal. Where do you stand?
Okay. I think the first thing to note is that those who stand to benefit have been the worst sufferers. So we are not just standing to benefit now. We are here to correct something that has gone wrong for too many years. For example, you will note that the per capita, and per capita refers to the total amount given to you divided by your population. For Nakuru is 5,188. And the per capita for Lamu, for example, is 19,551. So we are not just saying that you are now increasing. So, when you focus on 1 billion, 2 billion, I think that's the wrong argument. The point is, we want to move our per capita from maybe 5,000 to about 6,700. And that of Lamu, which stands, for example, at 19,500 per capita, can now move from 19,000 to probably 15. So that while Nakuru is at 6 or 7, the other one is at 15. But when people focus on the absolute number of Nakuru gaining 1 billion, or Singishu gaining another 1 billion, we are completely losing the talk. And I think we must also agree that the issue of there being varied varied development, so that maybe in one area there's lower development than the other, that is a reality we can never run away from. But you must agree that this formula is not there to address that problem.
But Governor, there are those counties like Marsabit in the northeastern region that feel losing nearly 2 billion shillings would really affect their budgetary operations. These are your colleagues, and you know what it takes to run a government. What do you think should be done in the meantime to ensure that, yes, you want that, is it equity or equality for the counties, but also not to adversely affect the service delivery in those counties that have been used to more resources in the past?
I think I would ask the same question. If your per capita in one county is 19,500 and another one, the per capita is 5,188, and we are both expected to deliver services to the same people, we are supposed to give them roads, we are supposed to give them water, we are supposed to give them education and all those. And I just want to give you an example of where these disparities have gotten us to. A child coming from a county like Nakuru, the maximum bursary you can get will be probably something like 5,000, 10,000, 20,000 maximum. We have never heard of figures beyond that. But when you come to where you're enjoying higher per capita, you will find that it is possible for a child to be even get full sponsorship even outside the country because they have those resources and the people are fewer. So what we are currently seeing is that our urban areas and high population areas will continue going down, and probably in a few years, the escalation of slum areas, especially in urban areas of Nairobi, Mombasa, and the others, will continue going up. So I think we need to agree this. This problem of unequal development had already been seen during the 2010 Constitution, and it is for that reason that we came up with what you call the Equalization Fund, and a conversation on how we can be able to bring some of these areas up. And they are part and parcel of this country, and when they remain low, we also get a problem. So we need to be asking, for us to bring them to that level, this is what we need to do. And in our opinion, at the Equalization Fund, even if it means increasing that fund so that it can address some of those issues, that would be the best thing. But when we talk about revenues that are meant to be shared across all counties for the purpose of delivering a service, and one county is getting 5,000 and another one is getting 19,000 for the same citizens, then I think it's a problem.
So how are you running your operations currently? Because you understand that the funds for 2020, 2021 have not yet been shared, bearing in mind that the formula is not yet out. How are you dealing in Nakuru?
Okay, we must agree that every county right now is going through very serious difficulties, noting that, as I have said, much of our budgets have actually been shifted to go towards health. So one of the problems we are facing is that if you don't pay your people on time, if you don't give them the allowances, if you don't buy the PPEs, then you even have a bigger problem at the health level. So I think we have made this matter very clear to the Treasury, and I think the President has also given very, very deliberate instructions that the issue of paying what is due must be done. But I think beyond this, you have asked maybe why we have not been too vocal. I think the debate is not at the counties. The debate is in Senate. And therefore, being in Senate, the conversation is for senators to conclude. It's really not for governors or anybody else. And I think what we are asking for now is that as soon as we conclude this, and everybody has a role to contribute in ensuring that we fight the pandemic. For Senate, their role is ensuring that this formula goes through so that the counties can now start delivering the services that they ought to be delivering.
Right, and Governor, of course, we'll wait for Senate to resolve on that. I am sure they have taken your views into consideration, or they will. But focusing on the control of budget report, there's a report that came out recently in as far as the expenditure of or the implementation of budgets up to March 2020. This is talking about the third quarter of the financial year that just concluded last month. And it shows that Nakuru County was only able to absorb up to 14.3% of the development budget. For the current expenditure, that was, the absorption was at 59.3%. What is the biggest challenge? Because we've seen counties like Nyandarua absorbing just 4.1% in development budget. What is the biggest challenge to implementing these development budgets 9 months into a financial year?
Okay, I think the first thing to note is that for what budget are we talking about? You know, when you talk about projects, it's probably doing a school, maybe doing ECD classes, doing a dam here and there. So typically our budgets are passed, say, around August, July, August there. Then it takes quite some time before they can be loaded into the system. Then once they are loaded, as you know, you cannot start procurement before the budgets are actually processed. So you now have to start your BQs. You know, the procurement process in this country is very tedious. So actual doing of the work starts around maybe November-ish or December. So by the time you talk about March, you're talking about very short period, about 90 days and so on and so forth. The other bigger problem that we face, and this is true to Nakuru as much as it is true to all the other counties, is that for the longest period, our procurement departments were understaffed and they were not big procurement. One. And subsequently, for us in Nakuru, we are actually trying to improve our capacity so that we can increase that. And I want you also to appreciate that government procedures on procurement are very, very deliberate and very tedious. So sometimes to beat that, if you are to do it any other way, remember when you talk about open tender and all these other things, that is what government says. If you go outside that, now that is what they say, abuse of the procurement process, and you know what follows after that. So I think it's a matter that maybe as a nation we need to sit together, and maybe as you talk about 13% as of March, I think it's also good to look at these numbers within also the context of what is the national government absorption rate and what challenges. So I think this is a conversation that needs to be opened broader beyond that, but we expect even worse details this year, given that now from March, maybe up to June of this year, again, the coronavirus, and again, you have issues to do with if it's a project and it was being done in one area and maybe the contractor came from a different area, again with restrictions in movement, we've had a lot of problems.
Right.
Where it's supposed to have open tender and it has to be nationwide, again, all those issues come up. But I think the bigger problem would be how can we enhance our procurement across all counties?
Okay.
Ensure that our departments are well equipped.
Of course, Governor, the reason I'm asking that is because you have a development budget for the financial year 2019-2020 was a total of 10.94 billion shillings, but 9 months into it, you had only spent 1.56 billion shillings. And of course, the question in so many people's minds is, with April, May, and June being the months that we are fighting the pandemic, how exactly are going to achieve this? So I don't know. I don't know where we go from here, because again, the essence of devolution is for development.
I think development is continuous, and I think that's what we need to agree, that some of the projects run year on year. So what happens is that there are projects that run 2 years, others run 1 year, and so on and so forth. So like we have said, for those that have to be for this year, so you have to start the procurement this year and finish, I think that's where we've been having a challenge. And most of the county governments, if you look at the structure of our budgets, they were doing year-on-year budgets. We didn't have what you call like 2-year, 3-year sort of budgets. And I think that's the kind of budgeting that we need to look at.
Okay.
And I think beyond that also to agree that when it comes to absorption, again, the sort of layers that have been put in terms of bureaucracy, they are for a good purpose, but the unintended consequence is that there's a lot of delay in procurement, and subsequently we are not able to do as much as we would want to do. And at 13%, which is low, I must agree, you can imagine we are nowhere near being the last ones. There are many others in that category. And also when you look at the size of our budget, you cannot compare, like a county with maybe 5 billion budget to one of 10 or 15. So there are all those issues, but I think the point is, can we add capacity across our counties? That's a big issue.
Okay, a very important conversation to have there. Now, Governor will later be speaking to the control of budget. That is Margaret Nyakango. We'll be sure to raise some of those concerns that you have. Thank you so much for joining us, Governor Leki Nyanjui of Nakuru County, for taking time to speak to us. So we take a short break here on Daybreak. On your return, we'll be speaking to Daniel Yumbia, who is the Chief Executive Officer at the Kenya Medical Practitioners and Dentists Council. We'll be looking at the changing strategy in the fight against the pandemic.